All right, let's just jump right into this explainer. If you're a first-year physiotherapy student, you've probably spent hours staring at a textbook, right? Trying to wrap your head around calculating joint angles and force vectors. Well, today, we're going to demystify exactly how our muscles move heavy limbs by turning all that complex biomechanics into simple everyday playground physics. We're going to look at the human body entirely through the lens of lever systems.
We've got a brilliant lineup to get through today. We're going to cover the game of torques, then break down first, second, and third class levers using seesaw, wheelbarrow, and catapult analogies. After that, we'll hit the grand mechanical trade-off, and finally, look at what happens when we go beyond the simple lever. Starting off with Section 1, the game of torques. Look, to understand any joint rotation, you really have to know who the players are on the field. So the crucial point here is that in absolutely any lever system, there are basically two opposing forces battling it out around a fulcrum, or an axis. You've got the effort force, which is always the winner driving the rotation. It's acting right in the direction of the actual movement. And then on the other side, you have the resistance force. Sadly, this one is always the loser in our torque game. It's trying its hardest to rotate the lever the opposite way, but it's just getting overpowered. But a force doesn't just work all on its own. It has leverage. And we measure this leverage using what we call moment arms. It's pretty straightforward. The effort arm is just the physical distance from the joint axis to the effort force, and the resistance arm is the distance from that exact same axis to the resistance force. Where that axis is placed relative to these two moment arms, that is exactly what determines our lever classes. And this is where it gets real. This brilliantly illustrates why this matters so much for you in the clinic. If a muscle is actively shortening and pulling a segment in its direction of pull, well, it's winning. It's the effort force, meaning it's a concentric contraction. But let's say a muscle is actively lengthening, like when you're slowly controlling the lowering of a heavy box. In that case, it is the resistance force. It's technically losing the tug-of-war, which makes it an eccentric contraction. Knowing who's winning and who's resisting is literally vital for your clinical observation. Okay, moving right along to Section 2, first class levers. Let's see how this actually maps onto human anatomy. You can easily picture this one as a classic playground seesaw. Just like a seesaw, the fulcrum, which is our joint axis, sits smack dab in the middle between the two opposing forces. Now, because the axis is right in the middle, the effort arm can actually be larger, smaller, or even exactly equal to the resistance arm. Honestly, it just depends on where you're sitting on the seesaw. Now, what's genuinely fascinating here is seeing one of the rare human body examples of a first-class lever. You don't see this often, mostly because our muscles rarely attach on the completely opposite side of the joint axis from the external force. But take a look at the supraspinatus in the shoulder. It pulls down on the greater tubercle of the humerus on one side of the glenohumeral joint, while the weight of the arm and gravity pull down on the completely opposite side of that joint axis. It's literally a perfect anatomical seesaw. Let's step it up to Section 3, second-class levers. For this one, the absolute best visual to keep in your head is a sturdy wheelbarrow. Think about a wheelbarrow. The heavy load of dirt sits right in the middle, sandwiched between the front wheel, which acts as our axis, and the handles, where your hands apply the effort. Because your hands are applying that effort all the way out at the ends of the handles, the effort arm in a second-class lever is absolutely always larger than the resistance arm, no exceptions. So where do we actually see this in our patients? Well, think about a simple heel raise. When your patient stands up on their tiptoes, the axis of rotation is right there at the joints of their toes. Their entire superimposed body weight is pushing down right through the middle of the foot. And then, all the way at the back, pulling up on the heel, you have the calf muscles acting as the winning effort force. Because the muscle has the longer lever arm, it's a highly efficient textbook second-class system. All right, Section 4, third-class levers. Now, this is the big one. It's the most common setup in the entire human body, and it operates a lot like a drawbridge or, my personal favorite analogy, a catapult. In a third-class lever, your effort force is applied squarely in the middle. Since our muscles usually attach incredibly close to the joint axis, their pulling force essentially gets sandwiched between the joint itself and whatever external resistance they're trying to move. Mathematically speaking, this means the resistance arm is always going to be larger than the effort arm.
Try to picture this. Your patient is sitting on a table, extending their leg while wearing a heavy weight boot. The knee joint is your axis at one end. The weight boot is the resistance, hanging all the way down to the foot. And the quadriceps muscle? Well, it attaches at the tibial tuberosity, which is super close to the knee. That muscle's effort is completely sandwiched right in the middle, making this a classic third-class lever. Which brings us to section 5, the grand mechanical trade-off. Once you understand that almost all of our muscles actually work as third-class levers, it leads to a pretty massive revelation about how we're truly built. To really grasp this trade-off, we need to quickly look at mechanical advantage. It's a simple formula that measures lever efficiency just by dividing the effort arm by the resistance arm. If your effort arm is bigger, like in our second-class wheelbarrow example, your mechanical advantage is greater than 1. That means you don't need nearly as much force to lift a heavy load. It's super efficient. But here's the crazy catch when it comes to the human body. Since the effort arm in a third-class lever is always smaller, our muscles are operating with a mechanical advantage of less than 1. This means our muscles are forced to exert exceptionally huge, seemingly inefficient forces just to overcome relatively light weights and win the torque game. So you really have to ask yourself, why on earth are we built this way? Why be so inefficient? Well, here is the brilliant trade-off. We purposefully sacrifice raw, efficient strength for speed and range of motion. Think about it. Because the muscle attaches so incredibly close to the joint, it only has to shorten a tiny fraction of an inch to fling your hands or feet through massive arcs of motion at unbelievable speeds. If we were built mostly out of second-class levers, sure, we'd be incredibly strong, but we'd move like slow, lumbering robots. Third-class levers are exactly what allow us to throw a fastball or sprint down a track. It's a total game changer. Section 6, Beyond the Simple Lever. Now, before you march this new knowledge straight into the clinic, we do need to step just a bit beyond this simple lever model. Our sources actually explicitly caution us about this. Breaking human movement down into just an effort force and a resistance force is a fantastic teaching tool, no doubt. But to be totally honest, it's a massive oversimplification of actual human kinetics. See, physics tells us that rotation actually requires a force couple, literally two forces acting together. An effort and a resistance just pushing against each other, that doesn't make a force couple. What the simple lever model completely ignores are all the hidden joint reaction forces, like the capsular constraints and ligaments. Those are the structures that serve as the actual physical pivot points for these rotational couples. These hidden internal forces are exactly what maintain the structural integrity of your patient's joints while they're moving. So, as a future physio, levers are your foundation for sure, but they definitely aren't the whole house. The next time you see a patient perform a bicep curl or a simple heel raise, don't just look for the seesaw or the wheelbarrow. Ask yourself, what unseen capsular forces are really acting beneath the surface, holding that joint together while the whole torque game plays out? Keep that question in mind, and I promise you, you'll be seeing human movement like a true expert.